Hi, everybody. My name's Tyler Kuhlander, and today I'm joined by Alan Morris. Today we're diving into a very critical topic for the DME industry. Today we're going to be talking about navigating the payer landscape and the evolving nature of that. Joined with me today, like I mentioned, is Alan Morris. Alan, how's it going today?
Hey, Tyler, great to see you. Thanks for the introduction here. Things are going well. Look forward to chatting about what's going on with the payer landscape, Medicare Advantage, private insurance, Medicaid. Lots of shifts going on, and looking forward to talking about what that means and the cascading impact to DMEs today.
Awesome. Yeah. So let's start big picture at a high level related to Medicare Advantage, as you mentioned. As we know, enrollment with Medicare Advantage has really skyrocketed over the past decade or so. According to the latest projections that were released by the Congressional Budget Office, this year 57% of the Medicare population chose to enroll in a Medicare Advantage plan. This leaves the other 43% of Medicare beneficiaries in traditional Medicare plans. This is noteworthy mainly because by 2034, over the next decade or so, the CBO is projecting that gap to widen even more. We've received data that shows this could reach 64% for Medicare Advantage, so another 7 to 8% increase could still be out there in terms of enrollment, which would then also impact and decrease enrollment with traditional Medicare. Alan, could you touch a little bit on, just those figures and why they matter to our industry and kind of what that means for stakeholders?
Yeah, absolutely. It's a big consumer base for DME. That's a population that's at an age where they're consuming a lot of DME, and the more we see the aging population in the United States, plus continued adoption of Medicare Advantage over traditional Medicare fee for service, just leads to exponential growth in not just that population, but the importance to the DME community and the importance of having those Medicare Advantage contracts. From 2016 to 2021, we saw Medicare Advantage enrollment grow by more than 50%. And as soon as we get some new data heading into 2026, I anticipate over the last 5 years, we'll see the same thing again, that over a 5 year period, we see more than 50% increase in enrollment in Medicare Advantage, just further magnifying the importance to DMEs to be in network with those Medicare Advantage plans.
Yeah, absolutely. So obviously, some of those growth projections are really important for stakeholders to understand. But one thing that we'd like to call out is we have noticed within the last couple months some press releases and headlines around major Medicare Advantage payers actually saying, not so fast when it comes to the growth that the projections from the CBO show. In recent months, we've seen indications that some of those big payers are actually expecting Medicare Advantage enrollment to decline this next year for the first time in over 20 years, with some projections showing that the decline could be roughly a million beneficiaries. This kind of comes from some decisions at these major payers to scale back their plan offerings heading into 2026, eliminating plans and really affecting enrollment in Medicare Advantage because of that. So, on the sidelines right now, in terms of, like you said, we do need some more data and more time to understand, the impacts of those decisions that major payers within the Medicare Advantage space, those decisions they've made to, pull back plans in certain geographies. It's yet to be determined the impact of that, but it's definitely something that, we want to make sure to acknowledge, monitor, and understand as this develops even more.
Yeah, totally agree, Tyler. It's a little bit to be determined. We should have some new data that'll tell us whether or not enrollment's actually declining, probably in the next month or two, I would suspect. But I've seen those same comments that you're referencing, those major payers, all suggesting that enrollment will likely be down in 2026. What we also saw, though, is that CMS, as those payers started to comment publicly about their sentiment towards enrollment projections, CMS was quick to say that they don't yet buy into this, and they're standing behind their original projections. And that's a sentiment backed by the Congressional Budget Office. Neither of the government entities have suggested that they anticipate enrollment being down in 2026. If, however, the payers are correct and enrollment does in fact go down heading into next year, this could, and it's a big could, It could have seismic impact on the longer term strategy of DMEs. So most DMEs have been preparing for a day where north of 30 or 35% of all DME consumer activity flows through Medicare Advantage plans, a third of all the activity flowing through Medicare Advantage plans, which tend to prefer the narrow networks that were mentioned. That said, if we are on the front edge of a shift back to traditional fee for service Medicare in some capacity, that's also got ramifications associated with the competitive bidding program. So we might be moving a little bit anyway away from Medicare Advantage if the payers are correct, and away from some of those narrow networks that Medicare Advantage is driving back to fee for service. But as we all know, competitive bidding is still on top of mind for a lot of providers when it comes to Medicare fee for service. So a lot hinging on the direction of Medicare Advantage and Medicare fee for service, two things that are really intertwined with each other.
Yeah, absolutely. And if we really, take a look and zoom out at the broader payer mix for DME spend overall, a decade ago within the industry, private pay accounted for, roughly 38% of the spend, with Medicare, including traditional and Advantage, was about 30%, and then the other third being Medicaid. But, based off these projections over the next decade, we're projected to see an increase in Medicare up to 45%, which then has an impact on, the other payer buckets within the industry. And that's a big shift overall. So we have two dynamics there in terms of, the projections for where the money has been in the past from an expenditure standpoint, trying to figure out where it's going. But then, as we know, monitoring some of the decisions that payers are making that directly impact Medicare Advantage.
Yeah, totally agree. It's a big shift. 14% more Medicare funded dollars flowing through DME over the last decade. And much of that we expect will continue to come through Medicare Advantage plans, even though there's a little bit to be determined as far as what the exact trajectory of that is. But we know that it's going to be a material portion that continues to flow through Medicare Advantage, which prefer those aforementioned narrow networks, making strategic alignment for DMEs with those plans even more important than ever before, and continue to be the case as we move forward.
Yeah, and we also see, private health insurance spend, not specific to DME, but just all across healthcare in general. Projections showed a decade ago that spend being around $900 billion. That's cleared more than $2.5 trillion now, with it being projected to grow at a 5% annual rate. That's definitely something to monitor as well. The growth in employee-sponsored insurance is really something that drives private health insurance market growth overall. But, while the population is aging at a rapid rate, DME providers should also not forget that other payers are also riding significant growth and spend across all categories of healthcare, but DME as well.
Yeah, looking at that payer data that you mentioned across the broader healthcare ecosystem can certainly help DMEs understand trends impacting referral sources like health systems. So looking at Medicaid specifically, it's on a similar trajectory. $500 billion in Medicaid program about a decade ago to over 1.3 trillion, or almost three times over the next decade, with growth rate on an annual basis of about 6%. Inflation, enrollment increases, all of the above, and higher per capita utilization are driving the surge. So lots of shifting going on, but lots of growth in the DME space across all payers.
Yeah, absolutely. And I think for, our listeners, obviously a couple key takeaways, one being that the payer landscape is shifting fast, but there's a lot of different resources and things out there to help you keep your finger on the pulse of, these things as they come up and continue to evolve. But there's also a couple different action items that we thought of for DME stakeholders to consider. And that's just, number one starts with being fully aware of your payer mix, making sure you understand where your dollars are coming from today, but then also, using these projections and data that's available to understand where they could be coming from in the future. So just, doing that current state and future state analysis, but then also working on strengthening relationships with key payers. So, once you understand the payer mix trends in your area and for your business, you can then make decisions around that align with the right payers. Looking at your geography, is it more saturated with MA enrollment, or is it higher in fee-for-service Medicare? Understanding the age of the demographic that you serve. Is it a younger population? Is it older? And then, really making sure, we've talked a lot about Medicare Advantage, but also making sure your private insurance partners, being aligned with them, the financial goals that they have for the plans and programs. And Alan, you mentioned health systems and all the things that go into partnerships with those referral sources. And that's really the last key piece to tie this all together, is making sure to educate those referral partners on these shifts and how these different plan changes can affect access to DME, coverage to DME. So physicians and case managers can really be partners for you when it comes to, one, doing that education on shifts that you're seeing, but two, being partners with referrals and things of that nature. So those are three different takeaways to tie, what's going on to what it means for your business and the impact that the action items you can take can have on your business.
Yeah, well stated, Tyler. Couldn't agree more. Because of the propensity for narrower networks fueled by the growth in Medicare Advantage over the last decade plus, and now the resurrection of competitive bidding, at least in some form, also driving narrow networks across Medicare fee-for-service. Strategic alignment with key payers, your any DME's geographic area is more important than ever before. Just networks used to be broader and more accessible, and that's a dynamic that we've seen change, and it's exacerbated by some of the shifts that we've talked about over the last few minutes here on this podcast. Getting aligned with key payers is the key to the future for our DME listeners out there.
Absolutely. That's all we have for today's episode. Please, if you found this episode helpful, feel free to share it with your peers. Alan, thanks for joining me. It's always a pleasure, and we'll see everyone next time.
Thanks, Tyler. Thanks, everyone, for listening. See you next time.